abnormal, okay? When you're in basic, you assess normal stuff. Your patient is not in the hospital because everything is normal. So I shouldn't have a whole bunch of normal stuff written here. That's not why your patient's in the hospital, okay? We taught you normal stuff in basic. Now we're going to talk about patients who are not normal, okay? So that's what you're going to collect that assessment data. Then, based on that assessment data that you collected, what is relevant and what is clinically significant for your patient? In other words, they have crackles in their lungs. They have some open sores on their back, their whatever it might be. Okay? You can collect normal stuff here, but there better be some abnormal stuff there too, or there's no reason why they're there. Sometimes you got to dig for that. Now the clinical reasoning begins. You've collected all this data and you've said, why is this important? Now we're going to start using our reasoning. And it says, what is the primary problem that your patient is most likely here for? I got all this data I've collected, but why are they here? Sometimes it might be as insignificant as they need placement and they live at home and they can't take care of themselves at home. And we can't just put them in a box somewhere until we find a nursing home for them. So we have to get creative about why we're keeping him in the hospital for a week while we find a nursing home that will actually take care of him. Or it might be because they fell and broke their hip and now we've got to do this. Whatever. What is the primary problem that they're most likely presenting with? What is the underlying cause of that problem? What nursing priorities will you guide you through this plan of care? Does this sound familiar to you? What is it? It's the nursing process. It just doesn't in that funny format that says patient will, blah, 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 nurse will, blah, blah, blah. But it's the same exact information. And it's way more user-friendly. And you don't have to worry about exact words. What nursing interventions are you going to use because of this? Okay, and it wants 9. And their rationale. In other words, I'm going to do these 9 things today, and here's why I'm going to do them, and here's what I'm hoping will happen. But they're not written in that same format. But it's the same information. What body systems will you most thoroughly assess based on what you've collected? Yes, I'm going to do a full and complete head-to-toe assessment this morning, but when I go to do that second assessment, I don't have to look for head lice or skin breakdown. I know that they're here because their respiratory system sucks. So where am I going to focus my attention? Heart and lungs, peripheral pulses. Okay, what focused assessments am I going to do based on what I know? What is the worst? This one I'll ask you. I'll ask you this. What's the worst possible scenario that I'm going to anticipate? Because if you don't recognize that, you're not safe with that patient today. What's the worst possible scenario here? And what assessments am I going to have to do so that I notice the early symptoms? I'm not waiting until they're in a coma and having seizures to notice that their sodium's out of whack. Right? What assessments am I going to keep doing for early recognition of this worst case scenario? And then what interventions am I going to initiate if this happens, besides come and tell me right now? I don't want to find out at the end of the day when you give your nurse report that your patient's O2 has been dropping since 6 o'clock this morning. And they're now 60s over 50s. Or 60s over 30s. Okay? I don't want to know that their O2 was 91% when you did your first assessment this morning and now it's 86. That's significant. And that if you didn't come and tell me that, I have to assume you didn't recognize that as a problem. Okay? That makes sense? So, here's some new orders, or here's some orders that are going to be a big deal to me, and here's why. And here's why the doctor was thinking that. These are the care provider orders that you might have, and they give you new orders throughout the day. There may be new orders depending on changes that happen. Okay? Or when they make rounds. What are they and what significance? Or maybe there's no new orders. Or maybe they wrote a new order last night for this, but now I'm seeing this change. You can tell me when it was. And then there's a list of the medications. How do they work? And what do I need to, as a nurse, why is that a big deal? That's kind of the same, only it's not near as detailed as the other one was. What educational priorities do you identify for this patient? I better teach them this and this and this and this and this. Yes, ma'am.
For the meds, it says for the ones that you'll be giving during that day. So we just do the ones we give the patient? Or do you want all of them?
I think you should do all of them.
Okay.
Because that has, if you're writing all of those and looking all of those up, you'll find all of their diagnosis. What does that patient need to be taught? And are there problems that are going to prevent you from being able to teach that? Then the next part is, can you empathize with that patient? Okay, what are they most likely going through right now? And I know this, and I may not agree with this, but I recognize it. And then what am I going to do about it to be a therapeutic for that patient? Okay? I'm really kind of crass sometimes, and I say things about patients that are funny but not necessarily nice. That does not mean I do not understand what they're going through. It means that I've done this a long time, and that's sort of a nurse thing. Nurses can talk about the most disgusting things while they eat their lunch. Okay.
So for an experience, say that they're feeling depressed because now they can no longer be at home
Yes.
because they fell.
And they're going to have to move to a new home.
And I can emphasize with that because of being displaced.
No, but what are you, not how you can empathize it, but that you recognize it.
Recognize
And
it.
what are you going to do to help that patient through that situation? And yeah, maybe you'll talk about that, but your focus for therapeutic communication is always on getting more information, right? You'll notice that in your questions, in your test. Therapeutic communication always asks for more information. Because if you start assuming that you understand and you stop asking for information, assume. You know that word makes an ass out of you and me. Right? So you don't want to assume you know that. You want to keep asking for more information. So instead of, oh, I know you feel bad because of this and this and this, ask. Well, how could you rephrase that to be therapeutic?
So tell me why you're feeling that you're not wanting to go to a nursing home.
What are you worried about? What is your biggest worry about this? And then they'll say, well, I have this cat. Oh, tell me about your cat. Just more information, more information. Well, I've had this cat for 20 years. This cat used to belong to my husband, but he died a few years ago. And this, whatever it might, keep talking. Because you know what that builds? Relationship. And it shows that you are caring and you care about that person. And then they will tell you other things that you need to know because they will trust you. You have about 3 minutes to build a relationship once you walk in the patient room. If you knock on the door and you start apologizing for living, and you can't talk to the patient, you are going to get nowhere. You have to put yourself out there. But you have to be wise about it. Okay? You have to read people like a book. If they don't like to talk to you, be quieter. If they like to joke, joke. If they don't like to be touched, don't touch them any more than you have to. If they need you to hold their hand, do it. Read people. How are you going to know those things? You're going to learn to read people. And if you've never been a CNA, this will be a big, big step for you. Every semester I have students who have been a CNA forever, and I can tell they were a rock star. And I have students who have never been hardly in a patient room except in nursing school, and I can tell in 2 seconds who it is. Because it's just an art that you learn. And you'll get better at it. You'll get better at it. SBAR. You know about SBAR. That's what it's here for. You're going to give your report to the nurse. Your SBAR isn't going to the doc. But at the end of the shift, you're giving report to your nurse. Your nurse gets report from you. She knows just what I ask. She knows just how to take report from you, and she will ask you questions. Because they're really helpful to us. Okay? They are our best friends. Yes, some of them are better than others. Some of them are more friendly than others. Some of them have quirks, and I'll try to warn you about some of those, because everybody has quirks. You know, like, I don't want to see your cords wrinkled up and you're messed up and your room's a mess. Well, some of them have quirks. And I'll try to warn you if I know. But that doesn't mean I want excuses or complaints about your primary on your anecdotal. Don't do it. Fatal mistake. Because that's who your partners are, and that's a team member. Figure out how to get along with them. Build a relationship. Just like you do with your patient. Anything else I need to say about that?
Nope, we're in for this afternoon, Jen's Watercrest.
What time?
1:30.
At the lab?
Yep.
Awesome. Jen's going to do it?
Yep.
That's even better. Any questions about this form? Oh, shoot. Bad button. I have a bad button. I told you about my car. I'm probably going to have a dead battery. I have jumper cables. I think. I left them on my other car.
I have jumper cables if you need them.
Good. Prepared. I like that. Write that down. Just prepared. Okay. We're going to go over some of these other things when we are on the floor this afternoon. I'll show you a daily planning guide that's going to help you get organized with your day. I'm going to show you how to stay on the time frame. That's going to be your biggest hurdle at first, is getting your time organized. You're going to feel like you're catching your tail for a while, but you'll get better at it, okay? You will. And if you're struggling and you're dying and you're falling way behind, ask for help. Watch your buddies who are rockstar CNAs and ask them questions. Last year I had the sweetest child come into my class and she was like, I've never been a CNA. And I see these girls do this and this and this, and I'm like, oh, what a great idea, but I never think of them myself. They can't help it. They've just never done it before. So help them. Help them. They want to do it, they just don't know. So help them. Okay? That's being a good team member. Okay? Make sense? You can help them. And you know what? When you help them, you get better at it. Because you start thinking about what you did. And you do it without thinking now. Okay? Is there anyone here who has never been a CNA? Okay. Well, this is your lucky day. You got a lot of friends who are. Look around. You'll see who to go to.
It's
Right?
not a bad thing. They're saying
No,
that you.
it's just your experience.
Mhm.
She's like, oh God, I wish I'd have worked as a CNA. I'm like, well, Yeah, it's the hardest job I've ever done in my entire life, and I've done some big jobs. And being a CNA was the worst job, hardest job I ever did. Hardest job I ever did. But I survived as a CNA, so I decided I could be a heck of a nurse.
And we didn't have to do that before we got in nursing
Yeah,
school.
she had never been a CNA.
So,
I'd worked as a CNA. I worked as a CNA, I worked as a CNA the whole time I was in nursing school. I worked full-time as a CNA. I worked the weekend program. Oh my God, does anybody have that at their workplace? You work every Saturday and Sunday, every one, but you get paid for 3 days. But you get no Saturday and Sunday. So I went to nursing school all week, and then I worked all Saturday and all Sunday at the nursing home. I have 9 kids. Did that. You can do this. It's a short period of time. Get some coffee, and you can do it.
I don't know why these are spicy.
But figure out what it's worth to you, because if you're not willing to do whatever it takes to do it, you can't do it. You can do anything for a short period of time if you decide to do it. Okay? Just figure out what it is you have to do and be willing to figure out how to do it. If you can't figure it out, come ask me. I'll tell you. Or I'll give you some suggestions. And she'll be way more tactful than I will. I'll just tell you. Okay? But we'll help you. That's what I want you to know. But don't wait until it's too late, because then we can't help you. And some of you, I'm just going to say it right now, might not make it. That does not mean you cannot be a nurse. That means you're going to try again, and you'll be better at it the second time. Got it? We'll do everything we can to help you through. But I will not pass you if you're not safe and you're not ready. I won't. I'll do whatever I can to get you ready. But if you're not ready, I will not send you on, because it would not be good for you. It'll hurt like hell if you don't make it, but it will save you in the long run. Okay? That's the cold hard facts. Okay. See this dealing with bullying and incivility? That might be me. Okay. I hold your future in the palm of my hand. That's a good thing for you. It is. Trust me. It is. I have very successful children. Every one of them. There's not a loser in the bunch. There's one I had questions about for a while, but they survived. And they have come around. And they're on their way to becoming a superintendent of schools. I'm like, oh, this is going to be so good. So don't miss that bullying one. Oh, there's those there's a few assignments that we don't have paperwork for, like the care management, the walk nurse, and the diabetic educator, and those. You don't have to do paperwork assignments for those. I want just a one-page narrative. Here's what I saw. Here's what I thought. Here's what I learned. It's just like a little report. And sometimes if you come to the floor after you're done with those observations and you end up on the floor before it's over, I might say, tell me what you learned today. And you talk to me for a while. I don't even have you write that. That's just so I can see if you actually, what you thought of it, what you learned, I can ask you questions. I can help you process that information, okay? Those are not a big deal. You don't get any points for them. They're just communication pieces, okay? Let's talk about paperwork. Heidi, you want to talk about paperwork?
Yeah.
Which one do you want to talk about first?
You can click on any of them. I think just the main thing.
Surgical?
Sure.
What do you want?
We don't necessarily do every piece. But I would
I
suggest to
want to talk about
you,
one thing on the dialysis one.
I would suggest that when you do these assignments, whether it's your surgical paper or your care map, that you take out your rubric and you do your assignment based off of that, because that's what I'm taking points off of. So if you're not even looking at this when you're doing your paper, how do you know what you're being graded on? Okay, anytime I do an assignment, I have that thing out right next to me, because then I can go, oh, did I do this? Yep, I should get all 5 points for that. Did I do this? Yep, I'm gonna get all 5 points for that. So you should know kind of what you're gonna get on the paper if you've done it. Now then it's up to my discretion whether you did it well or not, but you should at least get points for doing it. Some people will completely miss
The rubric.
doing stuff and they'll get 0 points.
We lay the rubric right on our desk when we grade your paper. I look at the rubric and then I look at your paper.
I don't just go in and grade it whether I like you or not. You know, I have to go off that piece of paper. And that's your justification to say, hey, I did this and I think you missed it. Because sometimes that happens too. If I'm looking at your care map and it's the 10th one I've done and I can't stand to look at them anymore, I probably missed something on there. And if you can say, nope, this is where my diet pyramid is, oh, okay, I'll give you the points back on that. So that's kind of your way to justify
Good
that you
fences with
did
good
something.
neighbors. This is a fence.
Okay, on these papers, do not cheat. It sounds really dumb, and I will find it. I don't know why or how I have that special superhuman ability,
Because she used to cheat.
because. But you can hand it in, and your peer can hand it in 8 weeks later, and I will know that it's the same thing. Because something in my brain just says, this sounds familiar.
Or you plagiarized it.
And that's exactly what happened a couple of semesters ago, and they failed the class because of that, because it's hard to recover from a zero. Because I can tell you, your care map grades will not be stellar, especially the first one. Your first one will suck. You'll probably be really upset about it. Your second one might not be too bad.
But you might pass.
But I'm talking like D's and F's. So don't feel bad. So a 0 on top of any of that is not going to put you at a good place. You could be amazing in clinicals, but if you have a 0 in your written work, that's going to be very hard to overcome. So don't cheat. If you don't cite your work, you have to have a reference for your surgical papers, like an article that you use. If you don't put an in-text citation, all that information in the paper you're telling me came from your own brain because you didn't cite it. You can have it at the end of your paper in your reference page, but if you didn't actually cite what material in your paper came from that article, you're plagiarizing.
Did you get that? There must be in-text citations.
I'm a little more lenient on that, and maybe just take off a couple points if you do that, but higher institutions will kick you out of the program for that. I won't kick you out.
We've been asked to put these on Turnitin. Have you ever used Turnitin?
Yeah.
If it's above a certain percent on Turnitin, you're toast.
Mm-hmm.
We've been asked to put it on Turnitin. We're not going to put it on Turnitin, but we're really good at catching it.
If it sounds like something language that shouldn't be coming from your brain because it's
Well, you don't know
extremely
these
high
things.
level.
You're learning
Exactly,
these
right.
things.
How are you going to know what a surgical procedure's names and equipment and all that stuff is called? I don't know that stuff. If I read about it in an article and I'm using it in my paper, then I have to give them credit for the work that I'm using. So don't plagiarize that way, and don't copy off each other. Okay.
Those are
Literally had a paragraph that was verbatim from one student to the next student on a surgical paper. It's like, do you not think I won't find that?
Oh, it got better from there.
Yeah.
Sit them both down and say, how do you explain how these paragraphs are exactly the same?
I don't
And you know what they both said?
I don't
She cheated
know.
off me. You're both toast.
I don't know. Yeah, so just don't do
I
it.
have no
Save
idea.
yourself a lot of, because it's up to us what happens from it, and I don't have time to let you redo it, which is one of the options, because I have way better things. No, they're not better. I just have way more things in my life to do than to read another surgical paper. So you won't get another chance
Yeah,
to
you
do
don't
it.
get to redo it.
You'll just get
Remember
it.
that line on the syllabus? There will be one attempt on this assignment.
so you'll just get a 0 for it. So don't cheat, okay? And follow the rubric, and you should be fine.
Okay,
If you have questions about it, come see us prior to, not after the fact.
dialysis paper. I want to point out a couple things to you because every semester we have a problem with this. So if you need to take notes, do it. Okay, here's your rubric for your dialysis paper. It talks about peritoneal dialysis. It talks about hemodialysis. It compares and contrasts peritoneal and hemodialysis. And then there's all the mechanical stuff.
And this is the same as what we've used before.
Yes.
Only the surgical one has been updated.
Yes.
So see the bottom column? Unfortunately, I will say I don't like this rubric
I hate
very
it.
much because that looks like something at my master's level class. 5 or more mistakes and you get a 0.
On
I
that
mean,
part.
I mean, that's
That's really
tough.
hard.
How can you write like a 7-page paper and, I mean, you have 5 mistakes? That's what I'm graded on. However, that's what's on your rubric. You get
Well, you do have spell check.
0. But that's
Use
not
it.
the only thing. I mean, APA is a lot more than just your spelling.
Right.
Okay, so, you
But
know,
don't lose your 5 on spelling and grammar.
even if you got
punctuation.
everything else right, 15 out of 20 is what your grade would be. So take it to the writing coach.
That's 75.
That's a 75, if everything else was perfect.
Now, I wanted you to have more direction than that. Therefore, I created this for you. A series of questions which should be covered in the paper. What is hemodialysis? What is peritoneal dialysis? How do they differ? How does a patient participate in their care? Like, what does a patient have to do to be compliant? How does a patient participate in hemo and peritoneal? What access devices are they going to have? Are there certain medications that they're going to be on? Tell me about those medications. Lab tests that might be pertinent for dialysis patient. What kinds of diet and fluid restrictions are they going to be on? What are some of the psychosocial considerations? Who can work in the dialysis unit? What kind of training do you need? And then it says find an evidence-based journal article. You don't have to do that. You don't have to do that. But do not hand me this paper with these 10 questions on it with your answer under each question. That is not an APA paper. These are merely a list of items which should be covered in that APA paper. Does that make sense to you? That way you have more direction on how to write the paper than just what was on that rubric. Because I'm like Heidi, I don't think the rubric is specific enough. So when I'm looking at peritoneal dialysis, those are the questions I'm going to look for. When I'm looking at hemodialysis, those are the questions I'm going to look for. Did you talk about their diet and their fluid? Did you talk about their meds? Did you talk about, what? Did you cover all those things within that paper? Does that make sense?
Is there a
Is
good
there a
place?
page limit or like a page? You just need all the information.
Yeah, you
That
can
is
write,
correct.
please don't write 27 pages.
Yeah, I don't want
but
20
mean,
pages. Most
Right.
students can do it in 5 pages-ish.
Okay.
In-text citations.
If you say you use your textbook, put it in your textbook somewhere, okay?
Is there a good place to find these evidence-based papers?
Scholarly, in the college,
From the library?
in the
Okay.
college site.
Yep, Cinol,
CINAHL and what's the other, EBSCO,
yeah. Cinol and EBSCO host, yep, Medline.
Medline.
I
Don't
just
give
wa- I
me
just wanted to make sure.
WebMD. That is not a scholarly paper. That is not evidence-based.
So no
You should not
Wikipedia.
Google
No
it.
Wikipedia.
You should get it through CCC's stuff. So if you're
And this is due when after we go?
a week,
A week.
What's doing a week?
after your
After-
experience.
Okay.
So you lucky people who get to do these all the first 2 weeks, good for you, all your hard stuff's done.
Or bad in a way that,
Well, you gotta look at the upside of stuff. Okay? I put in your stuff for sim number 1. There's all your prep work for sim number 1. I put in your stuff for sim number 2. There's 2 patients there. That doesn't mean you're gonna do 2 patients at sim. It means I'm gonna pick from one of those. Okay? And I might even tell you ahead of time which one it will be. But by then you're gonna be a rock star. Because that's the last day of our class. Okay? The CBCs, the BMPs, bad labs, don't miss them. I put them in there for a reason. Attitude is everything. Go team, right? There you go. Any question?
did you show them the care map one real quick?
Oh yeah, I'm going to the care map. You're right. Skipped it. I goofed. Care maps. There are 2 separate rubrics for care maps. They're kind of the same, but the 3rd care map will use a 2nd year rubric, which is it has a few more, what do they, you have to include more nursing
I actually haven't even looked at it.
priorities.
I haven't looked at it yet.
There's
Mine
just-
might not look like that. I don't think I updated those. Might have.
But I've included both of those, level 1 and level 2, the rubrics. Okay, patient code. This does not mean DNR, DNI, that isn't what it means. It means their initials. It's gotta be on your map somewhere. Or SR, 87-year-old, male. That's the patient code, okay? And yeah, you're gonna put in there that they're DNR, DNI probably, but that's not what it means on your care map. You can't put patient information, so you have to use that coded stuff, okay? And it's usually what you start the center of your map on, and then it branches out from there. Pathophysiology of your primary medical diagnosis. What does it mean? Signs and symptoms, how was it diagnosed? What kind of treatments are used? What kind of nursing care is important? I want all of it. This is textbook information. And then you're supposed to put an asterisk on the stuff that is pertinent to your patient. Okay? 5 nursing diagnoses. I think that level 2 one has more nursing diagnoses.
Just one more. 6.
Yeah, and it might have more interventions on it too, if you look at your
Yeah, I just
nursing
had it up.
process.
There's
But
not
that's
much
where your
difference.
difference is gonna be basically on the level 1 rubric and the level 2 rubric. The risks, signs and symptoms. Make sure you've prioritized them 1 through 5 and that you have a rationale for why they're 1 through 5. And then the meds, all the meds. And the meds get grouped by why they're taking them. You're not just gonna put a list of meds on the paper. Over here on all their cardiac stuff, that's where you're gonna put the cardiac meds and the blood pressure meds, and it's all because of this problem over here. Your patient might have, this patient in the middle with the code, patient code might have 6 different problems. Usually they're organized by systems, like body systems. And then from those systems, they might have 3 or 4 different problems with that system, okay? As long as it's organized, everyone has a little twist to that. I'll show you some examples. Do you have your key?
Do I have my what?
Key?
Nope.
Would you like to go find me some good examples?
I
Or
don't
you
think
want
we
me
have
to?
any back there anymore.
Good ones, you mean?
No, I mean, I think they got rid of them all.
So
No, they're there. I've just put some in.
with these care maps, what do you think people miss? Like, you know, you said the first one's usually really
The
bad.
first ones, they don't even get close to enough information on.
Okay, so it's the information.
They
not-
don't use the rubric and they don't get all the information on it.
Or like the purple one, perform and correlate head to assessment, what does this mean? What does this assessment tell you, why is it important? They don't even flat out do that.
Yeah, they just skip it.
So you get.
That's
half
4
the
points
on
you're
that
missing.
section.
You're saying like, if you follow the rubric, like,
Yes.
then you're,
You
okay.
can come on here and you can check off, I did that. I did preventative care, I talked about the medical diagnosis, I did why it's important, which current, past, I did this, you put X's by everything. You at least did it, now that it's up to us whether you.
Did it well or not.
But you at least get some of the points, I'm talking people get zeros in some of these
Use the
boxes because
rubric.
They didn't even look at this.
And then the next thing
And
that,
it's always a shocker, like we have
Oh,
this
yeah.
discussion.
oh my
everybody's
God, I
stressed.
got a 50 on my care, a 50% on my care
There'll
map.
be somebody
I
in
got
here that's like.
25
rubric.
points.
And so, I mean,
Well, show me where this is on your map. It's not there.
so just, and if you get to it, like I said, we're always available for questions. Now, but, so we, if you, something you're not really sure what we're asking, ask us. We can help you, but that doesn't mean bring a care map to us and have us grade it the night before and tell you what your mistakes are. 'cause
I'm not doing it.
I won't do that either. But I will help you if you've got a question or something like that, okay? I'm not gonna sit down
The other
for
place-
30 minutes and show you how to do it.
The other place people lose points is down here where it says links and propositions. So when you get all this data on your map, can you make a connection between the fact that they have diabetes, this patient with this problem over here that says they're diabetic, can you connect that to their kidney failure and their skin breakdown and their necrotic toe? And do you show links, that's arrows on your map of how all that stuff fits together? Oh, and by the way, they're on this chronic pain, they're on this pain medication because of their amputation, because of their necrotic stuff, because of their diabetes. But this pain medication has caused constipation. And this constipation has caused a bowel obstruction, which is why they are here today. And I got to be able to see that with arrows that link it together. And that's where the other place where people lose points. These are not perfect maps. These are examples of maps. And so we'll put a few out. Some of them are good examples, some of them are bad examples.
Oh, geez.
Oh, that's nothing.
So with the arrows, like, would you care if, like, we put our rationale?
You're going to present that.
Okay.
Your link is going to show us how you linked them, but you're going to talk about that.
Okay.
That's why you're presenting them to us.
And I set a timer, like 30 minutes. If I haven't, when it gets looked at in 30 minutes, is done. So I'm not gonna spend 25 minutes looking for something that I can't find on your map, because it's not obviously there.
And it's not
If I have
linked
to spend that
properly.
much time trying to figure out what you were doing, you're just not gonna get the points on it. Okay, so if you have.
You don't have to do your map on a board. You can do it on a presentation format on your computer. There are programs for that on your
Yeah,
computer.
like bubble.com.
Yeah, or what's the other one? There's several of them, okay? Care map creators on your computer. I've had students create them on their computer and print them on big paper. And if you take them down to the office place, they'll put it on huge paper if you want. That costs you. Some students just use these. I'll give you a real good tip. Don't put it on the board to start with. Find a place in your apartment or your house, a wall or a floor, where you can make sticky notes and start arranging it. Because pretty soon you're going to have to move whole sections of it and rearrange it. And you can work on organization and layout that way before you put it on the board.
Thank you.
And that's the benefit of doing it on a computer program, is those computer programs let you do that. But if you make it on sticky notes, and you can move them around, or move them around on your board. That will help you to make a better presentation. Here's what you can't do. You can't wait until Thursday morning or Wednesday for a care map presentation you have to do on Friday. This takes time. And then you got to go back and look at it again, and you might rearrange it. Run it by your friend. Present it out loud to yourself and say, that didn't make sense. I'm missing something. It's a study, because when you start getting a good one of these, I know that you understand your patient. It's how it all fits together. Okay? We have tons of these. There's probably 50 of them in there. Some of them are good, some of them are not so good. None of them are perfect. Oh, I don't even know whose that was.
It's fantastic. I mean, I can't read the information,
Yeah,
but visually, it's very nice.
Well, that's a start. Is it a mess? A hot mess? I like you to color code stuff. And almost always you need a key for your map. You know, every good map has a good legend. And so, like, I'm going to show you now.
Do you want us to put the color that coordinates with the rubric?
No,
Okay.
no. But I will show you another thing about it. There's a tool in here that I put in here to help you organize yourself. And you don't have to do it this way, but it helps you to organize yourself a little bit. This care map guide, I'm not an artist, okay, so don't judge. Here's how I started. Oh, the name of that online thing is Inspiration. I think it's Inspiration 9 or Inspiration 7, but there's others, okay? There's others. There used to be very few of them, now there's tons of them. Bubble is the other one, she said. Okay, so I start, step 1, with my patient in the center and all their problems, their conditions. So this person is diabetic, they got heart issues, they got COPD, they have some bone issues, they have some renal problems. Those are their big problems, all right? Then from there, I say, well, here's all of their lab data and diagnosis. And I group them by the problem that they go with. So this diabetic has blood sugars, this COPD person, here's their O2, here's their CO2, we have problems with their respiration rate, we have shortness of breath, whatever, but the labs. This is talking about the labs and the diagnostics. And you notice I made them all a different shape. Well, then on my legend I can put either color or shape or maybe both that represents the lab material and the diagnostics. Make sense? Then, after I get all of that information on there, I might add the medications. And they're all a certain color or a certain shape. But they're all grouped around the problem they go with. The treatments, the diet. Well, they're on a diabetic diet, so I have to put that by diabetes. And I might use a different shape or a different color for those things. Okay? Now I've got to add some other things because this doesn't give you everything. But now I might add my assessment data around each one of those problems. And I might make it a different color or a different shape. But each one of the items on that rubric gets added with the problem. That's why I'm saying if you start with a place with sticky notes or something, you can keep readjusting it and moving it so that you come out with something that looks good. Otherwise you get a mess where it's all clumped in one area and you can't do anything with it. Then when you get all done with your data, you start making connections. I don't think I'm cool enough to do that. Oh, I am. and you start connecting them. This doesn't give you all the connections, this just gives you an idea. The COPD has to do with the congestive heart failure. They have it because of, or they have congestive heart failure. The diabetes has led to the skin issues, or the bone issues, the tissue problems, and you start connecting those relationships with the arrows, okay? Questions? It's mind-boggling, isn't it? It is mind-boggling. And here's the best news of all. Your very first one is due soon. And some of you are only going to be on the floor a couple of days before that first map is due. Therefore, when soon as you get a patient, use them. Don't wait for the perfect patient for the care map. Start now. Okay? Questions? You're going to do 3 of them. The first one you won't spend near enough time on, and you'll do lousy. The second one, you'll say, holy smoke, I gotta pick up the pace here. And you'll spend a ton of time, and you'll start earlier. And you'll get a little better grade. And the third one, you'll be like desperate, or you'll be like, I got this. But you'll get better.
I hope this was a third one.
I don't even know what you put out there. But you can see that some people spend a lot more time than others.
Oh, yeah.
And some of them did a lot more thinking than others. Guess who got better grades? Yipper? Questions? No? Yes? What is it? Over. Perfect. All right, there's a few things that we'll be looking at when we come to the hospital this afternoon. I want you to bring them with you, like bring yourself a paper with those on, so you might want a copy of your daily plan guide, your clinical assessment guide, and your charting guide, okay?